If you have a problem, solve it. If you cannot solve it, don't worry about it. I keep telling that to myself, and about 50% of my stress has been reduced, guaranteed. With that, hey everybody, welcome to Be Positive with Bally, episode number 18. Now, before we get started, hit the subscribe button, click like, and click share. Now, the numbers of COVID-19 is not reducing. In fact, it's increased again. Some call it the second wave, some call it the third wave. But I think it was the right time to invite, a doctor, a frontliner, a hero to share his views and his opinion on the pandemic. And at the same time, we will also be having a little bit of look into his life, how he became a doctor, and some fun round as well. So, ladies and gentlemen, I'm speaking about Dr. Navin, a frontliner in Malaysia. Let the dialogue begin. Dr. Navin, thank you so much for joining.
Yep, no worries. Glad to be on your show, Bally.
Now, before we get started, since the beginning of pandemic, every single doctors have been our heroes. They're called the frontliners, but I think to those who are watching, on behalf of them, I'd like to say thank you so much for your contribution, and the contribution is still going on.
Yeah, definitely, and not just the doctors, but a whole group of policemen and firemen and everyone actually. Yeah.
Okay. Now, we're going to be covering a little bit about yourself, some fun questions, and then we're going to dive down to the pandemic. Now, before we get started, how long have you been in the medical industry as a doctor?
Okay. I started off, I graduated in 2010. So it's about roughly around 10 years now. And so I started off as a houseman in Hospital Kuala Lumpur, basically the war zone of all the hospitals. And I moved on as a medical officer to Taiping for 2 years, and I was in ENT in Taiping. And in 2014, I took a decision to actually go into a private GP practice, which I'm currently running at the moment in Rawang. So, that's roughly a rough timeline of my medical career.
Okay. Now, Dr. Navin, the question is always like, why? Every single thing which we do, there must be a reason. So why did you decide to, become a doctor? There must be, a reason to it.
Yeah, there's always a reason in everything that we do, I believe. And you see, honestly speaking, being very honest, I didn't decide to be a doctor in the beginning. What happened was after I left school, I actually was very indecisive, and the trend was going on about ITs and computers at that time. And I graduated school, I think, in the year of 2000. So, I went into actually a diploma in computer science for 2 years. So I completed that. And somehow or other, I just didn't feel I was in place, and I felt something was missing. And my parents were encouraging me, but they didn't force me to go into medicine. So they gave me options, and I thought about it deeply, and I thought, this could be a calling to me that maybe I am probably made to become a doctor eventually. And I took the leap of faith, and eventually everything turned out pretty well. And I think I'm quite happy practicing what I'm doing at the moment, and a very fulfilling career, I would say.
Okay. Yeah. Now, Navin, the perks. There's always the special perks in every single job. From if you are in the IT line or in the corporate world, you get corporate rates, and obviously there's a special perks being a doctor. So what is the most special perks or the one which you really like as a doctor, you enjoy the most?
Okay, I'm in a GP practice, so I see a lot of cases across the board, from a basic cough and flu to things like cancers, which are diagnosed, and it can vary quite a bit. But of course, there are a lot of perks that doctors enjoy. I won't deny that. But to me personally, the best thing that I really enjoy is that smile on the patient's face or the family member's face
Okay.
when I actually, either get a correct diagnosis or I prevented a complication or, eventually I managed to cure the problem. So to me, that self-satisfaction cannot beat any other perks that I get. Yeah,
Okay.
so that's probably one of the biggest thing.
That means
And
you look at your job as itself, it's a perk because, you can avoid, you basically get the chance to help someone to avoid, complications and stuff like that. But as a doctor, I'm sure when you go out, there are special privileges. What are your most favorite special privilege as a doctor? Is there any?
So coming to the second part, of course, every occupation we have these privileges that we get.
Right.
Yeah, definitely. So my most favorite privilege of actually using the doctor title is actually when I speak to customer service. So I realized it many years ago that whenever I speak to people on customer service, and if I mention that I am Dr. Navin, things seem to get pretty fast. They tend to
much easier.
Much easier. So that's probably one thing I really love. And so that's one thing I really enjoy.
Okay. Yeah. All right. Now let's get to some fun round. I picked out all these weird questions from the great Google, and I've actually made my own version of fun round. So we have a couple of questions. Just go through it really quickly. So don't need to think so much about it. So the first question I have is, what is your cure? That means everybody has a way of, fixing hiccups. What is your cure of curing hiccups?
Okay. Probably,
it's a bit weird, right? I'm sure you never expected a question like this before, but what is your cure? What is the cure for any hiccups you have, or you tell your friends, what do you do?
Okay, of course, we as a doctor, of course, we always divide it into conservative methods and actually medical treatments. So when you come to conservative methods, something that just comes on top of my head, so will be things like, you breathe into a bag and you drink a glass of water very quickly. And that's a few things which actually help to get the hiccup off. And the other thing is holding your breath and actually swallowing your saliva 3 times. So that also can help to get the hiccup away.
Okay, now that's something I never realized, because always, my friends will tell, okay, hold your breath. I'm like, I'll be holding, but I never got to that, saliva part. So swallow part, I did not go. So I just was holding my breath, was holding my breath like an idiot. So now I know that, okay, hold your breath and, swallow your saliva. So at least something. Okay, so something we learned today. So another thing is just put bag and drink water quickly after that.
Either you breathe into a bag just for a couple of seconds, or the other thing is a glass of water, drink it very fast. It probably can help get there. Those are mild hiccups, and then it will go off. Of course, if you go to some patients with long-term hiccups, and then you got to go towards medical treatments and tablets and medicines per se. Yeah.
Okay. All right, but that's the quick tip of how to, a quick tip of hiccup relief. Now, next question. There must be one movie which you can watch over and over again. What movie would that be?
Okay, the one movie I really can watch over and over is a Hindi movie. It's called Zindagi Na Milegi Dobara.
Oh, okay.
Yeah, so that's one of my very, very favorite.
It's a very fun movie. Yeah, it's really fun.
And teaches us a lot about life as well.
Correct. I like the part when they go to the bathroom in Spain. Was that in Spain? So they went to the bathroom, and then the stranger came in, and they both
Yeah,
scream, and then they all ran out. I
yeah,
think that was one of my favorite moments of that movie. Now,
yeah, yeah.
final fun round, final fun question for in this round is that
All right.
if animals could talk, which one would you think be the most annoying one?
Cats. I mean,
I
that's
don't know
just
why. I don't know why, but I had that thought. I just got that feeling that you're going to answer cats.
yeah,
let's not let's not offend the cat lovers who are going to be watching. So let's move on.
yeah. Sure,
Now,
sure. No worries.
2020 has been, I think, the most unpredictable year for everyone. Yeah, with the
Yeah.
pandemic.
Yes.
Would you like to share your experience as a doctor, as a frontliner, to all the viewers?
You see, I'm a frontliner in a general practice, and
Hmm.
so sometimes my situation it's a bit different from the frontliners in a general hospital. But I
Right.
do have a lot of my friends who are in the general hospital as well.
Right.
So I would say the experience is, I mean, things are very different. Things are tough. You view things very differently since this year began, and especially from March onwards. And you see, when the cases have been picking up, lifestyle for everyone has been changing drastically. And as a frontliner, I think you are on your toes basically practically 24/7 for the last 6 months or so at the moment, I would say. And you are always alerted that there are cases of COVID coming in, or if you're in a general hospital, you have consistently you have been working or taking shifts with your colleagues, but it's not very easy to take leave at the moment as well for those frontliners in the hospital, leave alone general practices where we are individually managing the practice ourselves.
Yeah.
So it's a tough situation. I think it's not just for the frontliners, but I think everyone as a whole per se, and a very different experience I think we in this age group of this current era has faced. I don't think we have faced a big pandemic prior to this. So
Right.
probably it's something, an eye opener for all of us, and it's a challenge that we are facing daily and trying to overcome as much of difficulties as we can. Yeah.
Yeah. Now, I mean that I don't because you see, your friends were in the hospital. In fact, some of my friends as well, and
Yeah.
it's very hard to get in touch with them, and they don't have time. I wanted to invite more people to
Yeah.
share this whole dialogue session with you,
Yes.
but I don't think any less of or difference between yourself as a frontliner on a GP
Yeah.
versus
Yeah.
those who are in the hospital, because both of you guys or, both of the fields, or the either in hotel hospital
Yeah.
versus the GP. I think all of them are challenged significantly.
Definitely.
So, doctor, the question is, the routine, before COVID,
Yeah.
after COVID, how has your routine changed?
Okay, routine has, I would say, take a 360-degree turn all the way.
Mhm.
You see, basically, if you talk about routine as a GP, from the time the pandemic began in March in Malaysia, the routine for me has been practically focusing on seeing patients every single day, probably one off day a week, and the rest of the days I manage the practice. And
Mhm.
the whole routine of managing patients has become very different to before. And from March onwards, we had to take a lot of different steps where we have to screen patients before coming in. It's very different when patients go to hospital, I say example, supermarkets or shops. they screen, they write their names and their temperature, and they go in. But when you come to places like a hospital or a GP clinic, if the patient is not well in front of your door, even though their temperature is spiking, it's a bit absurd for me to actually not to allow him to come into my clinic, because that's my job. I have to see him. Whether he may be having COVID or not, it's secondary. I still have to see him and treat him, and eventually also track him down in a couple of days and see how is he doing. Eventually, did he end up going to the hospital? Did he get a positive COVID test? And see, that's the tricky part when it comes to medical practice. A lot of changes in administrative point of view has also been taken. And I'm also doing a lot of COVID screenings at the moment. From March till date, I've done almost, I think, about 3,000 to 5,000 people. So it's a lot of people that I have been screening as well. So things are very different, where prior to COVID, it was more of, solving their situations and problems, not much focusing. But now COVID is on top of the line. Anyone who comes in, it's either COVID until proven otherwise. Yeah.
Right. Now, some say it's the second wave. Some say it's the third wave. At this time, I don't think we're only going to be speaking about Malaysia, but globally, another wave has, started or erupted again, and numbers are spiking up. Now, as a doctor who's been, since March, you guys have been working tirelessly and, trying your level best in bringing the numbers down, in, they say, flattening the line, just basically making it go down to one digit. We even reached one digit in Malaysia. So we did. And so, would you say that this was expected, or this was a mistake, or how would your feeling? Obviously there must be a lot of hard work, blood, sweat. You guys have been, putting in, devoting in putting those numbers down. So obviously there must be mixed emotions, feelings when you see the numbers are going up. So how do you feel? Is this expected, or this was inevitable?
Okay, if you take it from my point of view, I personally think that this was inevitable. This was going to happen, as of course, you see, when you talk about a pandemic, we are dealing with a problem which we don't have a cure. We don't have a vaccine. So the ultimate way of controlling a pandemic is by controlling the spread of the disease. Right. However, the downside of the situation is that this is a disease where it spreads very easily, stays over on surfaces. The virus catches on people very easily. And the other thing is that we have so many asymptomatic carriers around. So being asymptomatic, no one knows whether, are you carrying the virus or not. Your immune system may be way too strong for you to exhibit any symptoms. So coming to the second or the third wave, I think eventually this was going to happen, not just in Malaysia, but globally. And things might even get worse before end of the year if things are not controlled. Even if you look at those footballers playing in the Premier League, for that matter, and they just had the friendlies in Europe. A couple of players, even Cristiano Ronaldo just got COVID. So as much as he didn't want to get COVID, I don't think he was exposed to, but even as people as fit as him has been diagnosed with COVID, that is just through testing. He probably didn't have any symptoms, for that matter. But because they screened him during the football match, they detected that he had COVID. So these kind of situations will eventually keep spreading, and I think the numbers will keep getting bigger eventually. Of course, we will have a big group which have been healed and cured and they recover. But there will be definitely people who have weaker immune systems and older patients, and those people who probably will have a bit more detrimental effect to their health because of the virus. Yeah. So that's probably something which we have to probably face at the moment. Yeah.
Right. Now, I'm sure many have asked you these questions, from patients to people who know that you are a doctor. Even your family members and your relatives probably would have asked you this question, and I'm going to be asking the same question. Any idea of when this will be over, or is this something which we will be living with for the rest of our lives?
I would say that when a pandemic like this happens, it's a virus that is going to stay for a very long time. This is going to be something in the environment for a very long time. I don't think anyone in the medical practice, or even the World Health Organization for that matter, thinks that, the moment the vaccine comes out, it's going to be 100% cure. I don't think it's going to reach that stage of 100% cure. It's going to be in the environment, and there are going to be flare-ups on and off as the years go by, just as other pandemics such as the influenzas and stuff prior to this. So there's going to be situations where, you will find the vaccine is eventually out, and, suddenly in a year or two, you'll find another COVID breakout in certain areas of the world, and things like that will definitely happen. But at that time, I think the world will be much better prepared to actually contain the disease at that moment, so prevent it from actually spreading even and making things worse.
Right. Two more questions. I mean, one question, one more request, one question, and one surprise for you, Doctor. That now, the final question which I have is, what would be your advice to the parents, who have young kids? And I'm sure, you have 2 kids, right? So, I'm sure many who are watching have kids as well. To the parents and to those who are, aspiring to become a doctor or to take medicine as a career path, what would be your advice to everyone?
Choosing medicine as a career, a lot of people will say that, it's a very daunting task. It's not a very easy career. A lot of time is going to be spent actually completing the course, leave alone practicing what you learn. And it's a lifelong learning. It's a lifelong journey. You will never hear a doctor saying that at the age of 50, they have stopped learning, because everybody is learning. So to those people who desire, or they think they want their kids to become doctors, I think, leave the negatives aside, think positive. And if your kids, or even the people who desire to become doctors, if you are determined and you think that this is the career for you, don't feel the negativity of that, it's a very difficult life. You're not going to get time with your family and friends. Of course, there are going to be sacrifices along the way. Everyone has to go through sacrifices. They are each on their own way. So, in medicine, it's probably a different path where, you have 5 to 6 years of studying, where you can take that away from probably your midlife. And a lot of people will say that, 5 or 6 years of my life just went by studying, but, eventually you will reap whatever, you have sowed. So it is definitely rewarding at the end. And I don't think you will find any doctors at the age of 60 or 70 saying that, I regretted becoming a doctor. Yeah. So you will eventually achieve a good time even at the end of the day. Yeah. So look forward to it.
Okay. That's a good advice. That's a really good advice. Now, last one is a request, a message to those who are watching. what would your message be? How, I mean, probably you could also tell everyone, how could everyone, to those who are watching, the public, how can they help the frontliners? I think that would be the final request for the dialogue.
Okay, how can everyone help the frontliners? Of course, the basic point here is that, of course, everyone keeps saying that adhere to the standard operating procedure. That is, of course, the top of the line, that, the more you adhere to the SOP, the least you spread the virus. You don't contract the virus, and it's eventually going to reduce the burden on the frontliners. Because mind you that at the moment Malaysia is facing a huge shortage of medical officers, and that is probably something which you really can do. The second thing I would say is that avoid going to the hospitals for unnecessary simple reasons which you think they can be managed outside the hospital. Because from personal experience, I've worked in the emergency department. You see various cases, and it comes to your mind that it's not as an emergency situation that you need to come to the emergency department. Things
like
can
example For example, if you want to have a full body checkup, you will just admit yourself. I think that is one of the most common cases I've ever, I've heard, from my doctor friends are sharing to me.
So it's best to avoid things like this at the moment, and things which are simple and minor ailments which you don't need to go to the hospital. Probably stay away from it, and that will really help and reduce the burden of patients to the frontliners, and they can focus on people who really needs to be seen.
Okay, thank you so much, Dr. Navin. Also, to those who are watching, I think one last one additional from me is don't panic. If you think that you're not feeling well, you're a bit under the weather, don't directly assume that it's COVID. A couple of days back, my sister told me, like, you know what? Oh my God, I got flu. Oh my God, I got sore throat. Oh my God, I'm COVID. So that caused a lot of stress. So I think everyone, don't panic. Don't panic, relax,
Definitely.
and just avoid going to, I think, people, they're crowded places. So don't do that. Stay at home. If you go to work, come back home, just be at home, just like how we are doing this conversation at home. So you will be safe. Now, Dr. Navin, I really sincerely thankful for your time. I know you've been tired. We were supposed to do this way earlier, but you've been busy with also the incoming cases and stuff. Sending you strength, sending you all the blessings, all the power, and you need it, because I know you start early in the morning and you go and drill down right till the evening before you can even have a little quality time with your family. So on behalf of all the viewers, and not only yourself, but I think I would like to take this opportunity to thank all the doctors from all the hospitals, GPs around Malaysia and around the world. Thank you so much. And the battle is not over, but you guys are definitely our heroes. Thank you, Dr. Navin. And as a token of appreciation, our food partner, Desi Tadka, will be sending you, love through a special meal. We'll get in touch, and we will get in touch, and I will arrange the delivery. Perhaps after the partial lockdown, we'll try to get the delivery done. So thank you.
No worries.
Thank you so much, Dr. Navin.
Thank you so much. Thank you, Bally, for having me. Thank you so much.
Okay. Bye-bye.
Thank you. Bye.
That was episode number 18 with Dr. Navin. Before we say goodbye, I would like to give a shout out to my partners from content, Be Strategic, Digital Artwork, DH Creation, food, Desi Tadka, video live streaming and production, Mosaic Production. And to those who are watching, please be safe, stay at home, follow the SOP. We will get through this together, and I'll see you next week on another episode of Be Positive with Bally. Bye-bye.